Right. So, hi, I'm Nicole Ammon. My background is clinical mental health counseling, and I'm an LPCC supervisor. I'm going to be talking about mental health issues amongst older adult populations. And as I said once already, I feel like I'm talking to a group of people that are maybe more expert in this, or at least in the population than I am, but hopefully it can be useful. By 2030, the World Health Organization estimates that 1 in 6 individuals in the globe is going to be 60 years or over. And while most individuals of those ages have pretty good health, many are at risk for developing a mental illness, such as depression or anxiety, and or a cognitive impairment of some sort. The estimations of how many people will develop a mental illness vary pretty widely. The World Health Organization suggests around 14%, where individual studies that have been international say that the rates really vary from country to country, from as low as 20% to as high as 33%. The rates for cognitive impairment with or without dementia are about within that same kind of range. The with dementia, I believe, was a little bit lower than the without dementia, but obviously all of these can cause an impact and a significant strain on quality of life. So depression, being one of the larger, mental health issues to consider, is correlated with a number of things. So it's shows high correlation with cognitive status, a poor cognitive status, with individuals who are in lower socioeconomic status. It has a high comorbidity with a number of medical conditions, such as cardiovascular disease, IBS, and other abdominal issues, heart conditions, and does show correlations with more severe disability if you have comorbid mental health and chronic disease issues. One of the particular areas that I like to focus on, not like to focus on, but I think it's important to bring attention to, is the correlations between chronic pain and depression. Chronic pain not only increases the risk for developing depression, but individuals with depression are actually 3 to 6 more times more likely to develop and experience chronic pain. And you can see that this really happens not only through inflammatory process, but through this kind of vicious cycle of thoughts contributing to behaviors, contributing to some somatic reactions of so having that pain and increased pain, which obviously is going to produce some strong emotions, which then can further the depression. And pain severity is strongly associated with depression in older populations and more often seen amongst females than it is males. A real risk that's associated both with chronic pain but with older populations is suicidality. And suicide is a risk that is both related to depression and independent of depression. So for 2019, global health estimates show that globally, around a quarter of the deaths from suicide are among people 60 or older. And from 2021 to 2022, we actually saw suicide deaths rise slightly over 8% amongst individuals who are 65 years and older, with men ages 75 and older having that highest rate of suicide. And you see that there's an elevated risk for all of these populations. So being male, the one statistic says 85 years and older, but it really is showing that anywhere from 60 years and older, you're developing an elevated risk for suicide. Being of an LGBTQ population, being Indigenous or a white American, various socioeconomic and geopolitical factors can certainly increase risk. Comorbid mental illness and comorbid chronic disease and disability, with cancer, HIV, and chronic pain all being quite high for developing an increased risk of suicide. Some of the things that contribute towards the mental health, towards poorer mental health of aging persons, it's a wide variety of things. I'm sure things that you talk about with a number of the cases that you present here. So bereavement and complicated grief obviously can contribute. With retirement or kids moving on, moving out, developing their own lives and kind of living their own lives, we often see them less. So there can be a loss of sense of purpose. With retirement and aging, there can be increased financial stressors and a loss of self-sufficiency. Loneliness and social isolation are major issues, which I'm going to talk a little bit more about in a second. Physical, verbal, psychological, sexual, or financial abuse or neglect. And there are statistics that show about 1 in 6 older adults experience some sort of abuse of one sort or another. Caregiving is incredibly draining and stressful, even when you're at the best of conditions. Caregiving can be a very straining process. poor physical health, having any type of chronic illness or chronic pain, and obviously the development of a neurological condition. So any kind of cognitive impairments, whether that be dementia or other cognitive impairments, can all contribute to the development of a poor mental health or mental illness. Social isolation is a really important one to consider. The United Nations estimates that more and more older individuals are living alone in the community. And in more developed countries that have more supports in place, which on one hand is great to have the supports in place in the community, that also means that more people are living alone. And living alone does not always, it could lead to an increased risk of social isolation. Social isolation is associated directly with a correlation with sedentary lifestyle, higher rates of smoking and obesity, risk of developing cardiovascular disease, and social isolation and loneliness have been shown to significantly increase risk of all-cause mortality. So obviously things that we want to potentially address. And I include this quote because I think it's a nice transition from the risks and potential contributing factors to what we can do to help support and support the mental health of and prevent suicide amongst. But suicide really isn't about death. It's really about a desire to stop suffering at all causes. So when we think about what it is that we can do to best support individuals who have some type of mental health condition as they age, it's really about helping them find, what is giving their life purpose, what helps them make their life feel like that it's worth living. And if there's a source of suffering, what can we do to identify that source of suffering and reduce or eliminate it to the degree possible? So things, kind of broad things that could be done to address or prevent poor mental health amongst aging populations. Looking to reduce financial insecurity. Are folks, doing okay? Basically, think about your Maslow's hierarchy of needs. If we can't think about how we're making rent and getting groceries and paying for basic bills, then we're not going to really be able to think about more existential needs. So really addressing those most basic needs first. Along those lines, making sure that there's programs in the community to ensure safe, accessible housing, whether that's in public buildings or in private homes, safe and accessible transportation, support for healthy behaviors, so help to eat a balanced diet, be physically active, refrain from tobacco and alcohol use to the degree that's appropriate for those individuals, health and social programs, things like integrated care. There's a program through the World Health Organization called ICOPE, or Integrated Care for Older People. And it's really a framework that outlines a continuum of care to reorient the health and social systems towards a more person and family-centered model of coordinated care for individuals. The US in general needs more mental health providers that are both trained in geriatrics and are able and willing to bill Medicare. Probably have a whole conversation about Medicare billing and who it is and is not allowed to bill for that, and how we need more of those providers, but that's probably a different discussion. And very, very importantly, and why I bolded it, even though it's the middle and I'm coming back, is that enhancement of social connections. Whatever we can do to help enhance social connections and reduce isolation and loneliness. I included this study because I thought it was kind of cool, but yoga. So regular exercise and cognitive training are both things that independently can play a positive role in sustaining both cognitive and mental health. And in the combination of that, so exercises that require this higher cognitive demand, things like yoga and Tai Chi, seem to be dually beneficial because they are engaging both your body and your mind. And a systematic review of randomized control trials, and they really filtered out a whole bunch of other studies just to look very succinctly at the randomized control trials, using yoga interventions and how that improved cognition and mental health systems compared to control groups. A number of studies found significant improvements in attention, executive functioning, and in working memory. And a number of studies also found significant improvements seen in self-reported measures of anger, anxiety, depression, reduction of stress, and overall mental health. So what we can do to both engage the body and the mind is going to be helpful for both our physical and mental health. And universal screening, with suicidality being a major issue, we need to be aware of what the warning signs are, aware of what populations are at a higher risk, be willing to engage in universal screening for both depression and suicidality when it's within a health center. And if within not the more traditional health context, if you can't administer a PHQ-9, just if you're seeing signs, ask, and then be there be there willing to listen, to support without judgment, and help folks connect. Lots of people, I feel like everybody texts now, but call, text, they even have, versions that you can get to through a web browser, but accessing 988 to, access the Suicide and Crisis Lifeline, super important. And then following up the next day, maybe the day after that, possibly even the day after that. There's good studies to show that just that following up not only helps the person to realize that it kind of keeps them engaged, but it also helps them to see that you care. I listed a bunch of citations, and I'm happy to take questions, but at this point, I'm going to stop my share and give you time for your case. And thanks for having me.